The FDA will meet in 1 week to discuss Moderna's and Johnson & Johnson's COVID-19 booster shots. The drug makers aim to join Pfizer in getting emergency use authorization to administer more doses.
So who will need the boosters, and are they any different from the third doses already available? Megan Malaris goes to the experts to verify.
Viewer Bob reached out asking, so why are we waiting for FDA approval when I can go to CVS and get a third dose now? The booster has to have something different? It makes no sense. Well, Bob, let's verify if there's a difference between a third dose and a booster. Expert sources are the FDA, Johns Hopkins University, and infectious disease physician Chris Uhl with Atrium Health, Wake Forest Baptist. They agree, yes, there's a difference, but only in terminology based on who's receiving the shot.
Getting a third shot means that you're getting a vaccine that was totally expected to have been needed in the series. So let's take, for instance, hepatitis B vaccine. It's a 3-shot series. It has been since the 1980s. And that's what you need to provide the full immunologic protection. So that's what we're doing for our immunocompromised people.
Remember, back on August 12th, the FDA authorized third doses of mRNA shots, Pfizer and Moderna, for age-eligible people with compromised immune systems. As Dr. Uhl and Johns Hopkins explained, people with compromised immune systems don't build up a strong response to the initial COVID vaccines, and a third dose can help. That's why they now can get a third dose at least 28 days after the second one to complete a 3-dose series. Now to COVID boosters. September 22nd, the FDA authorized boosters, but only for Pfizer recipients. They're available to anyone 65 and older, plus anyone 18 and older with medical conditions or jobs that put them at higher risk of getting sick. The FDA says these groups must wait at least 6 months after their second doses to get the booster, because unlike people with compromised immune systems, they don't necessarily need an extra vaccine until the initial series wanes over time. As far as what's in the shots, there's no difference between a third dose and a booster. The manufacturers haven't yet modified them for the variants. So what you're getting, you've already had. You're just getting more of it to protect against serious illness, hospitalization, and death. So in conclusion, we verified, yes, there's a definition difference between third dose and booster, but really it's mostly semantics. People with compromised immune systems can get third doses. People without compromised immune systems, but whose age, medical condition, and profession put them at risk, can get boosters. Yet third doses and boosters are identical to their original doses in ingredients and strength. With your Verify, I'm Megan Malaris.
And keep in mind, the FDA only authorized Pfizer and Moderna for third doses and only Pfizer for boosters. Also, as of now, the agency is not recommending mixing and matching shots. And if there's anything you want our Verify team to look into, just email us. Email those questions to verify@13newsnow.com.